नमस्कार दोस्तों। रियली सॉरी जो पिछला लाइव था वो डिस्कनेक्ट हो गया इंटरनेट कनेक्टिविटी की वजह से। बट अब मैं वापस आ गई हूँ इस लाइव वीडियो सेशन में जहाँ मैं आपके सेरिब्रल पाल्सी रिलेटेड क्वेश्चंस के जवाब दूंगी। आई नो ये बिना कोई इंटीमेशन दिए बिना कोई इन्फॉर्मेशन दिए मैं ये लाइव सेशन कर रही हूँ। इसका एक कारण ये है कि आई एम जस्ट कीपिंग बिजी विथ मैनेजिंग पेशेंट्स एंड विथ द टाइम। तो आज टाइम मिल गया तो मैंने सोचा चलो आज लाइव डेफिनेटली करना चाहिए, आप लोगों से बातें करनी चाहिए और आपके जो भी सवाल है उसके जवाब देने चाहिए। तो अगर आपको सेरिब्रल पाल्सी रिलेटेड कोई भी क्वेश्चन है तो यू आर मोस्ट वेलकम टू आस्क मी। बेल्स पाल्सी के रिलेटेड भी है तो भी आप प्लीज पूछ सकते हैं मुझसे आज के इस लाइव वीडियो सेशन में। आई एम हियर टू हेल्प यू आउट एंड आई एम हियर टू आंसर योर क्वेश्चंस। तो लेट्स वेट फॉर पीपल टू ज्वाइन एंड सी व्हाट आर द क्वेश्चंस यू हैव गॉट। और अगर आप लोगों को if you are not able to hear me out, if my audio is not properly coming, or if you are not able to see me well, please put it in the comment section so that I get to know that whether the quality of video that you're seeing is appropriate or not. If it is not, then I might need to modify my internet connection or anything I can do for that. Right? So I think there are three people online. Hello, everyone. Thank you so much for joining. And if you have got any questions, anything, feel free to write down, or else you can just say hi to me. It would be great, and also put a thumbs up, so that will make me more motivated. But make sure in upcoming days, a lot of videos are coming up, definitely, which would be more educational and will have a lot of further more vast information related to health and wellness. Yes, so that's what I'm going to do in upcoming days. All right. So before people start asking question, I think I can start speaking a bit more about cerebral palsy today because it's important to talk about it, and it's important to talk about one very important aspect which usually gets missed out, and that is about home-based therapy for the child and parenting aspect of the child. Yes. Mostly people whom I have encountered whose kids suffer from cerebral palsy somewhere develop this notion that their child requires way more effort, way more stress, way more focus than other kids. To an extent, it is true as well, but sometimes in this too much of focus, they lose the essence that the child itself is a human. It's a baby, it's a small kid who likes to explore things, who likes to learn new things, who likes to explore world. But sometimes, in that burden, that mental pressure of helping the child and making him better takes over that liberty, that freedom that parents need to give to their children to explore this world. And that also plays a very crucial role in helping the child development. So it's important that as a parent, you should consider a lot of parenting techniques which are very similar to regular parenting technique over a period of time. So in today's live, I would like to talk about that and also about how you can collaborate as a parent with physiotherapists to give a proper therapy at home. Now, if you have seen me or else my previous video on cerebral palsy, I have explained this many times. What is cerebral palsy at first place? So, cerebral palsy is a movement related disorder. It's a problem where there is damage that happens to the brain. This damage to the brain can happen either before birth, during birth, or after birth. In all of the scenario, what will happen is the child's ability to do this physical activities, the child's development, physical development, emotional development, mental development, somewhere gets affected. And when there are other complications like seizures, diabetes, vision loss, hearing loss, or any kind of things come into the picture, then things gets worse. And that's why rehabilitation or physiotherapy, occupational therapy, speech therapy, all of these therapies help the children to grow in their maximum potential. Hello, Mr. Puneet. Ma'am, what is treatment? Treatment for what, sir? You can just write down. So I assume you're talking about cerebral palsy, right? So I'll come to that. So again, coming to the question, what is the treatment of cerebral palsy, right? So to be very honest, there is no cure for cerebral palsy, and that's an hard fact that as a parent or as an individual and even as a therapist or as a doctor we have to accept the amount of grief or else amount of sadness or else amount of hopelessness that parents experience when they hear this news that cerebral palsy is not curable. Very similarly, that level of frustration even we as a therapist experience when we are treating or dealing with the child and we know this fact that this is not going to be cured. This is a problem. But apart from that, therapy helps. Therapy helps the child to improve in all their aspects of life. So, can you just elaborate what do you mean by HIE? I am not able to understand, or else I'm not aware about this term HIE. So basically, this therapy helps or it gives the hope to the parent that the child can live independent or else a life without disabilities or else with minimal disabilities. So that's our aim to minimize the level of disabilities as much as we can. So the focus of rehabilitation is on first identifying the weakness points, identifying the strength areas and combining these two to make child as independent as possible. Whenever a child suffers from cerebral palsy, there are three most important areas that gets impacted the most. The first one is the behavioral or psychological aspect. You can also say to an extent the IQ aspect, the learning aspect, because the child is not efficient enough to do the physical activity, even though he's intelligent. Okay, even though he's intelligent, when the child observes that he is not able to do the things as his peers are able to do, that leads to frustration, and that frustration sometimes leads to other psychological issues. Hence, parenting and counseling and psychologically developmental activities are very important here. A therapist who helps the child and the parent to bridge the communication gap between them, who helps the child with the coping strategies with the communities, makes child independent, open to accept the feedbacks, open to face the challenges and overcome the challenges as well. Apart from that, physiotherapists also help in sensory development. Okay, hypoxic ischemic encephalopathy again means, in a way, cerebral palsy. Because this is a pathology. Guys, I was telling something and suddenly I said this. So, we have got a comment by Mr. Puneet Alabat, which he is asking hypoxic ischemic encephalopathy is a type of brain dysfunction that occurs when brain doesn't receive enough oxygen or blood flow for a period of time. I understand this, sir. So this also eventually leads to cerebral palsy. All right. So the treatment of hypoxic ischemic encephalopathy is not focused on curing the problem that has happened in the brain, but is to work on identifying what are the limitations of the child and through the therapy help the child to achieve maximum improvement, maximum independence as possible. So the treatment comprises of physiotherapy, Treatment comprises of occupational therapy if required. Treatment comprises of speech therapy if required. It all depends on what are the physical challenges that the child faces. Because hypoxic ischemic encephalopathy can lead to different or it can damage different areas of the brain. And what area of the brain gets affected leads to the physical limitation. Hence, knowing which area of the brain is damaged is important. Correlating that with the physical symptoms that the patient or the child shows, and then coping up with it. Hina Sharma has a question about does sinus has to do anything with Bell's palsy? Hina, I'll come to this question later on. Please stay on the live because I was talking a bit about cerebral palsy. So I'll just complete that and I'll come back to your question. So when it comes to cerebral palsy, friends, as I said, the second important part is sensory development or sensory integration therapy. Now, whenever we are able to do a movement, we are able to do it with the help of three sensory systems. Your vision, which gives you the feedback that, okay, this is the space where I have to touch, this is the thing I have to grab. Your labyrinth gland, or is the sensation of balance which exists inside your ear, which makes you aware of which direction you have to turn and brings your eye also in that level. Sometimes that's the reason certain kids have squint post cerebral palsy as well, because their vestibular system is not affecting in one case, or else there is a central pathology involved as well. So, squint is also a very common problem in cerebral palsy, which is an associated problem that is seen. And then the third thing that is responsible is our proprioception, how we feel the joint position, how we feel our legs are, how we feel our move. All of these things, when combined, gives feedback to the person that okay, this is the object that I need to grab, this is the direction in which I need to go, this is how I need to do things. All of these things on total affects the recovery, and that's what sensory integration therapy does. It teaches the child to use different sensory feedbacks to make these children aware how to use the sensory feedback, and that familiarity helps the child to adopt to different situations. These sensory feedbacks could be anything related to a firm surface, soft surface, different type of texture exposure, pressure exposure, etc. And then the third thing that is taken care when it comes to cerebral palsy is about the motor development or is the development of the movements in the body. So, for example, if the child is not able to hold the neck, what's going to happen is the child will not be able to work or is function well from the spine. Hence, it's important to focus first on the neck symptoms or is the neck spasms or movements. That development, once achieved, should be then taken to progression of the crawling movement or is all four movement. After all four movement, then the progression should be taken to side sitting. And from side sitting to kneel standing, from kneel standing to standing, and from standing to walking. That's how the progression has to be taken. And that's what is all and complete rehabilitation program is formed from a physiotherapy or as physical therapy rehab perspective, which then is added up with speech therapy or occupational therapy if required when child shows related symptoms. So that's what is rehabilitation for cerebral palsy. In cerebral palsy, all kind of cerebral damages that happen to the child due to any of the reason, okay, comes or is get included. Even the child who suffers from a viral encephalitis or viral meningitis and develops motor impairments and developmental issues, even they come under the category of cerebral palsy if that has happened before the first year of life. So that's what I wanted to talk about cerebral palsy. I would like to take some questions that has come on the comment section. So hi Hina, taking up your question which is related to Bell's palsy. Does sinus has anything to do with Bell's palsy? Yes, it does has. So Bell's palsy also gets triggered or is people who suffer from upper respiratory tract infection or upper respiratory tract issues are more prone to develop Bell's palsy. That's a hard fact which has been proven in research papers. So I hope that answers your question, Rina. All right. So any other questions, guys, you would like to ask me, or you want answers regarding? You can just post it in the comment section. I'm hearing it out. All right. So if not, then I'll just quickly tell you also one thing. Okay, there is one question. Then Lakshmi, madam, which kind of walker is best suitable for spastic diplegic adults? So for spastic diplegic adult, depends again. How is your gait? Okay. So um, if your foot drop is not a problem, or if the toe walking is not a problem, right? If your foot is grounding well, then a simple crutch or as a simple elbow stick is fine. But if you have issues with even proper landing or is proper stability, then you need to go for an all four static walker, but not with the wheels. And it's good to have a walker which is from behind and not from front. That kind of walker is way more better in spastic diplegia scenario. I hope that answers. Hina is asking, thanks so much. Actually, I have both from last 2 years, and the recovery is very slow. So, Hina, sinus is not the direct cause for Bell's palsy. Sinus is a trigger or is a risk factor for Bell's palsy. All right. Now, if the recovery is slow, that is suggestive that there was a major damage that had happened to your ear or else to the nerve, the facial nerve, which has got paralyzed. Okay. So, it's very difficult to find out what extent this damage was, but ideally what you should do is you should make sure that you give enough support to your weak muscles, especially while doing your movements like speaking, chewing food, or else yawning, making big smile at that time, because these muscles are constantly trying to cope up or match the movements here. So there is no way to make a faster recovery. That healing takes its own time, but all you can do is you can prevent these muscles from going under spasm, which is a very typical of synkinesis development, which usually happens in people with late recovery. I hope that answers your question. Also, friends, meanwhile, I'd also like to let you know that I have launched an app which is called HealthQ Rehab app, and I'm providing free consultation. I would say almost free consultation, just at rupees one. Okay, it's an 30-minute video consultation, one-on-one. You guys can have with me just by downloading this HealthQ Rehab app. After the session, I'll leave the link to the app download in the description box. All you need to do is just download the HealthQ Rehab app, go to my profile, and choose the schedules or as the time slots that are available. Pay just rupees one, and you can connect with me for any of the problem that you are facing which requires physiotherapy help, and I would be able to help you out because I have got an amazing team of 8 physiotherapists who are specialists in different domains of physiotherapy, like orthopedic physiotherapy, neuro rehabilitation physiotherapy, facial rehabilitation, pediatric rehabilitation, and women's health physiotherapy as well. So, Hina, I would recommend you if you need further help, please download the app and connect, and let's have a one-on-one session so that I can understand your problem better and help you out further. Same thing I would recommend Dhanalakshmi Deva, sir. You can also book a this session, have a session, one-on-one session with me. It's just at rupees one, and I can hear you out. And after assessment, I can tell you a better solution for your problem. And same for Mr. Puneet. Even you can connect with me over this video consultation over the app, and I would be able to check or assess, take the history of your child, and I would be able to help you out and suggest you what we can do about it. Sounds great, sir. Great to all of you. If yes, make sure to download it today. Any other question, any ways I can help you guys, please feel free to post your question. We will be here again for another 5 minutes, and then we will end this live streaming. All right. So I think there are no other questions. Mm. All right. Meanwhile, I'll just ask you guys one question. Any particular video request you guys have? Any video you want us to make or me to make on YouTube channel, which will be helpful for you? You can post that as well in the comment section so that I can create a video on that and help you out further. All right. No comments again. No problem. I think almost all the topics are covered. That means right. Okay. All right, then, guys. I think there are no other questions. So I'll end this live streaming here. I hope you found this quick, short, simple live stream helpful. If yes, make sure to like this video, share this video, or else share our channel's video with other people. And I would look forward to meet you one on one on Health Rehab app. Thank you. Bye bye.